Hi, everybody. This is Dr. Cesar Velila. I have a residency from Brazil in plastic surgery, and I also have a medical residency in internal medicine from Chicago in United States. And today I want to talk to you about something really, really important, which can save your life, the life of your family, and the life of your friends, and the life of many, many people around the world. And it's the use of the face mask, something really important that you should watch this video to the end, and please share it to as many people as possible. So let's start with what our president of the United States saying about face mask.
CDC is advising the use of non-medical cloth face covering.
The cloth
So the CDC, which is the Center of Disease Control of the United States, is advising to the general population the use of face cover, right? So this is our general surgeon.
coverings recommended are not surgical masks or N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders.
So let's start right there. They're saying they're recommending just cloth masks and no surgical masks, which are these, right? Or N95 respirator, which are these, which should be reserved for medical professional. That's true because we don't have enough masks for everybody right now, but we're gonna talk about that in a little bit later.
Recommended by the current CDC guidance.
This is voluntary. I don't think I'm going to be doing it. I'm feeling good. I just don't want to be doing, I don't know, some.
Now, this is voluntary, for real, voluntary. You have so many people in United States. We are the number one country with the most disease in United States. And the CDC is making recommendation and you're telling the general population that this is voluntary. And what's the reason that you're not going to be wearing it?
Sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk, I think wearing a face mask as I greet presidents, prime ministers, dictators, kings, queens, I don't know, somehow I don't see it for myself.
So wearing a face mask in your beautiful Oval Office, greeting everybody, it doesn't look good. And that's your explanation why you're not gonna wear a face mask, and that's the message that you are showing to the general public in the United States. Come on, give me a break. Now, let's see what happened with another people ask you again about the same.
Wearing masks. And I know you told Steve about why you don't want to wear a mask, but I'm just wondering if you can tell us more about why, because it would
I just don't choose
an
to.
example.
They're not mandatory guidelines. They're guidelines. They suggest.
Yeah, there are guidelines. There are guidelines to follow. Of course, they're not mandatory, but there are guidelines to stop the spread of the disease. It's like stay at home. Stay at home is one of the things. Social isolation, social distance is the one of the things that can spread the disease. There are guidelines, and the guidelines are made to be followed.
You could wear them. You don't have to wear them. In fact, the director.
No, you have to wear it. It's not like you don't have to wear it. You have to wear it, and I'm gonna show you in this video why you have to wear it.
Here, if you want to say a couple of words about it, you can if you want. You don't have to.
And then you're saying that's not mandatory, that's not. So why other countries around the world that are not as developed as United States, they made this mandatory? So like Colombia, they passed this communication dated, it said April 4. So just yesterday saying it's mandatory to everybody that goes out and is in less than 6 feet from person to person to wear a face mask. Is mandatory. In Peru is mandatory. In Japan is mandatory. In all these countries is mandatory. And here our president is saying that is voluntary. Well, that's not right. It shouldn't be voluntary. So now let me show you a little bit what happened when you sneeze, so we have a better understanding why the uses of masks are so important. So when you sneeze, the sneeze can go up to 20 to 35 feet. And this is a video done by the Australian government when it was the influenza crisis a few years ago, showing how normal people can spread the disease. And the only way to stop this is using the face mask. If you use the face mask, these droplets are going to be prevented to spread it. Okay, so not even too long ago, a few years ago, in this famous TV show Mythbuster, it was one full episode about how well, what happened when you sneeze. Let's take a look. So here we have them doing the test.
Oh God, it looks like a murder scene here.
Some chemical, they put ink, and then they start measuring how much of that. So we can tell he sneezed. Look, he put some ink, and then in this test done in Mythbuster, the TV show, he went to 17 feet. 17 feet. But if you guys want to talk about science, let's talk about science. The Journal of the American Medical Association just released this article 3 or 4 days ago when it shows how the droplets can go. So there is two ways these droplets, when someone sneezes of cough, goes. So there is the bigger particles that they go immediately to the floor in about 6 feet. But then you have a little tiny small particles that those are the ones who travel very fast, and they can go up to 35 feet. So here in this sample, in this video that is computerized slow motion, you can see the amount of particle is insane. It's crazy how many of these can go. And this was published on the JAMA, which is the Journal of American Medical Association, and it's showing these findings. So here it traveled about 7 to 8 meters, which is about 26 feet. Look, this is insane. How far can this be spread? And then in the USA Today, just yesterday or the day before yesterday, they did a very nice representation of how these droplets goes. So it has two phenomena. One is the bigger drops that falls continuously and depending of the weight and some other factors. And then there is the small droplets that they go very far depending of the turbulence of the gas cloud. So here we can see that these small droplets can go up to 100 feet per second when someone sneezes, and the big particles can go to 3 to 6 feet. And then, just to give you an idea, a human hair, if you pick up one of your hairs, that's measured in microns. So it can go from 60 to 120 microns, okay? When you compare that to a droplet with the virus, that droplet is only, it can be only like 1 micro. So it's invisible to the human eye. So you may be thinking that is nothing there, but those little tiny particles are in there. So the CDC recommended that we have to maintain social distance about 6 feet to prevent this to be spread. But this is the scary part, that the moist turbulent gas cloud helps to prolong the droplets in a liquid form, which may help the pathogen. So these little tiny droplets, when there is a gas turbulent, they can travel very, very, very far away. And this in this study is even something more scary, and that's why it's so necessary to wear the face mask. And the study is showing that those little gas cloud can go into the ventilation system, and then they can go and infect the rest of the population. That's why the recommendation right now is everybody that works in the hospital, they need to wear a mask, because even if you're not in contact with, and this is something very new and is very scary, because if you are in a hospital or in a place when someone has a COVID-19, it is possible, and that was done in a research by the Chinese, and it was published also a few days ago. It is possible that these particles go through the ventilation system, and then they can stay up to 3 hours in the air. So everybody who goes into the hospital and all the health professionals should have some kind of this equipment. But unfortunately, we don't have that equipment for everybody here in United States. It's a shame, because the politicians should be able, and the government, to provide us with this equipment. So it's not a right answer to say, oh, we don't have enough, and then you guys should put a scarf, like the President Trump say. And so let's hear about what he's saying about how the regular Americans can protect ourselves.
Like, should we be wearing masks out? We've heard lots of different recommendations.
I don't believe, look, there's a big thing. A lot of people don't like it. Some people don't like it because you're taking it away from the medical professionals. Some people.
Of course, we're taking it away from the medical professional because we don't have enough. So all your resources should be invested right now in building mass and protective equipment. I say a few days ago that we don't have enough equipment, and it's true. So instead of being saying this is not a big deal or use a scarf to protect yourself, the U.S. government and the politician and everybody should be building all these massive factories to produce this to give to the general population so everybody can be protected.
Like it for other reasons. I don't see where it hurts, and it doesn't have to be a mask. It can be a scarf.
No, it has to be a mask. Of course, it has to be a mask. This is the right way to be protected. So don't say it doesn't have to be a mask. Now, we know, okay, we know we don't have enough masks, and we have to save those masks for the health professionals. But of course, it has to be a mask. The reason is that we don't have it, so that's why we need to find a different ways to protect ourselves, right?
Highly recommended by the professionals. I don't see where it hurts. I think, frankly, if people want.
Let's hear that again.
By the professionals. I don't see where it hurts. I think, frankly, if.
So he's talking about the scarves now. Let's see that again.
To be a mask, it can be a scarf. Scarf is highly recommended.
So he's saying a scarf is highly recommended. So I want to test on that scarf that is highly recommended. But before of that, I want to tell you a little bit about masks. So let me show you a little bit of what are masks. So this is a regular mask. This is a surgical mask. This is not recommended to prevent infection because some of those droplets can get in or get out of the mask. Then you have the N95 mask, which they block about 95% of the droplets, and it has a filter. Again, those masks are something like this, right? And then you have something else called respirators, which is elastomeric respirators. Those are more effective and stopping the virus because they provide a better sealing, right? And they block the same as these other masks, right? And but they have the advantage that those can be reusable, and then they filter most of the particles, but they has to be re-cleaned very often. Okay, so those are the type of masks. Now he's saying that we can just use a scarf, and that's the point I want to touch right now. But before going into that, let me show you how important is the use of masks. So we have this a beautiful video about the value of the mask. So we can see when someone is just talking, how much of the particle are sneezed out. When someone cough or sneeze, it's even more. But when you have a mask, then it's completely sealed, and then you don't have any of this. Now I'm going to do a demonstration following the president recommendation just to wear a scarf, and let's see what happens. Okay guys, so now I'm gonna demonstrate how ineffective is the recommendation of wear a scarf. So we're gonna try different scarves with different materials, and then let's take a look and let's see what happens. So first I'm gonna try one of the scarves that I use when I go on my bike, you know, like many of you have, something like this. Let's see if something like this works. So now I'm gonna remove it and I'm gonna do a test with some water. I'm gonna show you with this water. I'm gonna pretend this is the sneeze, like this. You see? So let's see if pretending that someone is sneezed through the scarf, if the drops are gonna go through or not. So the bandana test failed. So if you use just a regular bandana or one piece of cloth, it's not gonna work. So now let's analyze different materials. So I went to my wife closet and I started looking for some stuff. So let's see the first one. So we have here another bandana, and then we're gonna do the test again. We're gonna spray through the fabric to see what happened, and there you can see it went through. It went completely through. So this material also goes through, so scarf is not a good idea. Now let's take one more thicker material. So this is a big scarf, like the one that you put around, your neck when it's really cold. And then let's see what happened. So we're gonna do the test again. We're gonna spray it behind. There you go. And then it's about to come. Wait. You have to pay attention here to the green screen. There you go. Then it went through. You see, it went through again. So this one didn't work either. The particles also went through. Now we try another bandana, or I'm sorry, another scarf, another material, something more silky, to see if different material is gonna help. And then take a look again. It's gonna go through again. Another fail. So we're gonna spray it right now. Here is the bottle of water. Then we're gonna show you. It's gonna spray. One. There you go. It's coming. There. So you see the particles going through again. So it's a failed test too. So then we try in a regular surgical mask, okay? And then we sprayed it many times. It didn't went through, of course. So it protected for the droplets to get out. And finally, we try on the N95 mask also, and then it remains inside. So now the question is, if this material don't work, what are we gonna do? So they still work, but it's not just say regular scarf. So you have to do it on your own. Again, this is not what we're supposed to be doing. We're supposed to have this available to everybody. This is cents, okay? This is not a lot of money, a lot of dollars. So this is a material that we should be getting all everywhere. So now let me show you what is the right way to do this. And I did a little bit of homemade, how to do it. And I'm gonna show you right now how can you do it at home and being safe. Okay, but it's still a way that we can do it and we can be safe. So this is the most transparent one. You see, you can almost see through. But if you take this one and you fold it in 3 parts, so I'm gonna fold it in 1 part here, and then another part. So it's folded in 3. These 3 layers, it give you a protection. So to prove that, I'm gonna take a little tissue here, right? Very transparent. And I'm gonna put it in the other side. So we're gonna do the test. We have the tissue here, then we have the 3 layers, and now we're gonna spray it, okay? So 1, 2, 3, go. Again, do it many times. Okay, so that was a lot of sneezes. And then we look here at the paper. It's completely dry and it didn't go through. So it stayed here wet, but it didn't go. You can see it's all wet here, but it didn't go through the paper. So if you do this with the 3 layers, then you're protected. So now I'm gonna show you how to do a mask for your house just with a little piece of clothes, okay? Here is what you need. You need scissors, then you need a little bit of tape, and then you're gonna need rubber bands, okay? I'm gonna use 2 for one side, and I'm gonna use 2 for another side. This is gonna go into the ears, right? Okay, and then you need a little piece of fabric or bandana. And this is not ideal. I mean, we should all get a mask, even though government say no, it's not necessary for everybody, just for the healthcare providers. I completely agree. Doctors, nurses, we are the priority because we are in hospital taking care of patients, but everybody should be able to get masks. The government, the politicians should do everything possible to get masks for the people, to produce the mask, so we can get the mask. But since we don't have it, we cannot just be crying and not doing anything. So I already show you that just wearing a scarf is not enough. You need to do something else. So let's see. Let's make one face mask. So we have one of these, right? So the first thing we're gonna do, we're gonna fold it in half here, and then we're gonna fold it in the other half. So half and half, more or less half and half. Okay? Doesn't have to be perfect, but more or less like that. Then you fold it again in another half, and then in another half. So the way that this more or less is gonna fit your face, okay? So after doing this, you take the rubber bands, and then you put one rubber band in one piece, in one corner, and then you get the other two rubber bands, and then you put those rubber bands in the other corner, okay? So you have a rubber band in one corner, and then you have rubber bands in another corner. So then these two corners, you're gonna fold it again to the middle, and then the rubber band is gonna go here, and then the other one also to the middle. So kind of trying to do a mask. So now you have this piece here, right, with the rubber band here. Then you have this piece here with the rubber band, so you can tell. And now this is the tricky part, because now you have to put it on your face. So that's the tricky part. So you, with these two fingers, you hold it like this, then you put your face, and then you go down, okay? The problem is this, look, you have this opening here, which is loosened. So that's why, for that, you're gonna get, for that end part, you're gonna get a little bit of tape. So you're gonna get a little bit of tape here, okay? A little bit of tape. Then you're gonna cut the tape, and this is gonna go in your nose, okay? So we put the tape here, right? And then it's a little sticky, so we just put it here. And then again, we take the mask with the two rubber bands, then we put it in our face. Try to cover a little bit. Try to cover it. You have to cover it from here and here. It's not ideally. And then you take the little piece of tape, and this little piece of tape, we're gonna put it here. Try to cover. So right now we have a little bit of sealing here. Then we're good to go. This is protected. The water is not gonna go through. The sneeze is not gonna go through. Is not as effective as one of the professional ones, one of the ones that we have, but at least it's something that you can do. Remember, it's not just a regular bandana. You have to do it like this. You have to make it, to make it work. Even what you can do, if you want like an extra protection, you can take another little piece of tape and put it in the lower part, try to make a better seal. So again, you take it here, then you put it on your face, okay? You tape it. You tape it this one, okay? So you tape it, and then you take this other part, and also you tape it here. So you get a better protection, and even if you want, you can tape the size. So you can take another piece here, you can take another little piece, then maybe tape it in one side, right? And then take another little piece, and then tape it in another side. This is not ideal, but at least it's something that you have that you can protect yourselves. Okay, so this is all for now. So lesson to learn. Number one, we should be getting masks from our government. But since we don't have it, we have to keep the mask and then N95 for the medical professional and the people who are dealing with the sick people. We agree to that, even though that doesn't save the government responsibility to provide this mask for everybody. Lesson number two, we have to stay home as much as possible. Social distances is really important. Lesson number three, if you have to go out to a places when you cannot be 6 feet apart with someone, you need to wear your mask. If you have a mask, it's great. If not, do one the way I show you how it has to be done. It's not just to put a scarf, it's not just to put a little tissue, a little piece of bandana. It doesn't work like that. This is serious. Lesson number four, this is going to be over. This virus changed the way we're thinking, the way we're living, but we're going to go through this. We have to be positive, and then we have to work together, and then we're going to pass through this. Okay, stay safe. This is Dr. Lipo. I'll see you in another video.